Hello, everyone. I'm Dr. Fawzia Alvi. I'm a family physician. Can you guys hear me well? So I'm speaking to you from Calgary, Canada, and we are conducting this live webinar with healthcare professionals from Gaza Strip in collaboration with Muslim Association of Canada, Muslim Medical Association of Canada. I'm the president and founder of Humanity Auxilium. And the mission of Humanity Auxilium is to provide impactful medical relief and training to benefit marginalized communities around the world. We envision a world with healthcare equalities for the world's most marginalized people. As I said, that we are doing this with Muslim Medical Association of Canada, and their representative, one of their board member, Dr. Basreen, is here. Dr. Basreen?
Hi, everyone. Thank you for the introduction. I'm here as one of the board members of the Muslim Medical Association of Canada. For those of you who don't know, we are a group of physicians whose goal is to support our fellow colleagues and to promote health to our community and essentially improving health overall. And the reason we're here today is because of a duty that we have towards health advocacy. I want to quote this CanMed's framework for what a health advocate is, written by the Royal College of Physicians and Surgeons of Canada. As health advocates, physicians contribute their expertise and influence as they work with communities or patient populations to improve health. They work with those they serve to determine and understand needs, speak on behalf of others when required, and support the mobilization of resources to effect change. And in that front, we're here today to have this discussion and support our colleagues in Gaza as much as we can.
Thank you, Dr. Basreen. So I think without further delay, we will introduce our guest speakers, the doctors from Gaza and the other healthcare professionals. And I want to say thank you to you for taking the time to speak to us. I will introduce Dr. Ara AlQardi first. He's a medical doctor working in Gaza Strip right now. He's working for medical aid for Palestinians as emergency and medical hospital care program assistant. And Dr. Ara AlQardi, please tell us that how things are on the ground and how you've been feeling in the last few days.
Hello, everyone. Thank you, Fawzia, for introducing me. Do you copy me well, firstly?
Yes.
Yeah. So just again, this is Muhammad from Gaza. I'm a medical doctor working for medical aid for Palestinians, especially in the field of emergencies and complex hospital care. As you know, a ceasefire just entered its effect recently. However, the escalation and the situation is still really in need of a great help. And that is especially for the health system in Gaza, because as you know, it has been chronically deteriorating, especially with more than a decade of a blockade. That's also in addition to the frequent and the protracted emergency situations that result in a huge influx of complex injuries requiring complex surgeries and long-term healthcare and rehabilitation. For example, talking about the latest escalation, it resulted in more than 2,000 injuries. And given the mechanism and complexity of injury, the number would definitely put more strain on the overstretched health system here in Gaza. Just before the emergency started, MOH reported shortages of about 50% in essential drugs and about 33% shortages of disposables. And now you can imagine the state of services in the hospitals given those circumstances. Of course, also, not to mention the COVID-19 pandemic. Unfortunately, the escalation resulted in just above 66,000 people who were displaced from their destroyed houses to take shelters at UNRWA schools. Very overcrowded areas without the minimum of preventive measures. So at the moment, the concern about a third wave of COVID-19 here in Gaza is rising. Moreover, also the aggression has resulted in 18 healthcare facilities sustained damage. Also, on the other hand, electricity is a challenge. The recent escalation damaged 5 of the 10 electricity lines providing power to Gaza, and as a result, power supply decreased by 45%, with electricity available only for 5 hours per day. So, increased outages would really stop and reduce the operation of medical facilities, among other basic services here in Gaza. The situation is really appalling, and just recently, the other day, they have found more bodies buried under the rubble of their destroyed houses. The situation is really appalling, and a humanitarian support is really needed to help people of Gaza. That's just in a nutshell about the situation here in Gaza. Of course, there is more to it, but just in a nutshell, as I said. Um, for example, what here we have been doing on the ground, my organization, for example, MAP UK, and other humanitarian agencies and charities, they have been supporting hospitals, ambulances, and also the blood banks, procuring and providing essential medicines, disposables, lab reagents, and other medical equipment to respond to this influx of huge injuries. Also, that's in addition to supporting the response of the COVID-19 in the ministry, that is in particular regarding the CPAP machines in the ICUs, oxygen stations, and cylinders. We have been doing this like nonstop. However, the situation is really appalling, and more is still needed. So that's why a humanitarian and an urgent support should be really given to the Ministry of Health and the health system here in Gaza.
Thank you very much, Mohammed, for letting us know about the shortage of medications and the power outages and the destruction of primary care health centers and the hospitals and the damage to the critical care facilities. I hope that you can stay, because my colleagues here from Canada, they will have a question and answer sessions. So I hope that you can stay, but thank you very much for your time. So our next speaker is also from Gaza Strip. Doctor is actually a clinical nurse manager, Mohammed Sakar. He's working at Nasir Medical Complex in Gaza Strip. So Mohammed, floor is all yours. Unmute yourself, Mohammed. You are muted. Yeah, now we can hear you.
Can you hear me?
Yes.
Yeah, the situation in Gaza here is very critical and very serious. Actually, we face many tragedies nowadays here in Gaza, and we have been facing such tragedies for a long years ago. First of all, I want to say that Palestinian and Israeli clashes aren't new. They have been going on for long years ago. When the Israeli occupation army has occupied Palestinian lands, according to UN and International Security Council. Actually, this resulted in a serious catastrophe in humanitarian aspect and healthcare system. For a humanitarian aspect here in Gaza, you can see that the citizens of Gaza can just have electricity only for hours a day. And I think it's not enough just to meet the life needs or to live as people live outside. Also, we have poor sanitation. You can smell sewage odor easily here in Gaza because of poor sanitation. Because some of sanitations and some of the sanitation facilities were attacked by Israeli airstrikes. Also, you can see here kids without parents, parents without kids. Kids have lost their moms. Moms have lost their kids. It's really miserable. It's really miserable. Also, you can tell about the people who have lost their houses and sheltered in UN schools. It's really terrible when you see that nearly 450 houses were destroyed. It's illogical and it's really terrible. Actually, I want to tell you about the healthcare system. Our healthcare system has been deteriorating, seriously deteriorating for long years because of frequent aggression and the frequent wars against Gaza in 2008, 2012 to 2014, and at last 2021. These aggressions have seriously and have horribly affected the healthcare system. The healthcare system is already pressured and stressed. So everything is deteriorating seriously in Gaza Strip. In hospitals, we are lacking most medical resources to introduce or to give to patients to deal with patients. The situation is horrible, as I told you. Personally, for me, I was in a hospital, working in a hospital during these four aggressions, 2008 till 2021. And really, I have faced many tragedies that I will never forget. Let me tell you something about what's happening here in Gaza and how we work in our hospitals. I will give you some examples that may help you imagine the situation and the real situation in Gaza. For example, one night you receive 10 to 20 people dead. They come to hospital dead because of Israeli airstrikes. You find 10 of them are kids, but the kids are body parts. So your turn has changed from being a nurse or nursing supervisor to body collector. So you start just match the body parts together. This is crazy and insane, and this really make us seek for psychological support when you deal with killed kids and they come to hospital body parts and you have just to match the parts together. This is crazy. Another is sad even that, or another pressure that may really kill us and hurts our feelings. Um, I want to tell you something here. And we have received a call from paramedics that there is an Israeli strike against the people's houses. So there was a large number of people wounded and killed. So they asked our support because they lack an adequate staff to deal with such a crisis. That was in 2014. I have asked some nurses to go to help paramedics to get people to hospital and deal immediately with the injured. One nurse was Yusuf Sheikh Al Eid. I asked him to go and help paramedics to get the injured to hospital. He told me that the situation is very dangerous, Mohammed, so I can't go. I asked him to go and to follow the orders because this is a commitment towards our people. We are medical staff. So I told him the Israelis won't target us. We are just medical staff. He implemented and he followed the order and went to support the paramedics because of high number of injuries on the street. After half an hour, the news came that the nurse Yusuf, who I asked him to go, was shelled in the ambulance. He was killed. So that hurts, you know. You feel that you are responsible for what's happened, and I don't know. It's hard, really. It's hard. What I want to say that everything is a target for Israeli airstrikes. They don't distinguish between normal or say ordinary citizens or fighters. No, everything is a target. And actually, we received many cases once at the emergency department of Nasser Medical Complex. So we lack supply, we lack staff, and it's a big challenge to deal with such high number of cases. Another thing I want to tell you about is some of the challenges and the sad stories that we face here is like women that come to hospital and asking about her two kids. Who's brave to tell her that her two kids were killed? Who's brave to do this? And this is really hurts also. I want to tell you another thing about maybe I don't like to talk about it because I don't want to remember what about these events. I think it's enough. What I want to tell you that we are facing a serious challenge, especially in the medical and healthcare sector. Really, it's miserable here and it's terrible. And as a Palestinian, if this is happening in New York or in Canada, I swear we won't allow this to happen. Look, regardless of being Canadian or Palestinian or American, we share the same nationality. We are all human. So I think the Gazans are in a serious situation. The Gazans have a deteriorating healthcare system. We lack supplies. We lack medical instruments. We can't deal in such shortage to rescue people's life. Here's the point. I want to work. I want to just save lives. But give me the instruments. Give me the supplies that I may work with. Here, this is the situation here actually, and I have a lot to talk about. But I think maybe in the last I would talk about some needs about, here that we need urgently in Gaza. Thanks.
Thank you very much, Mohammed. We can tell that the situation is critical over there, and I don't know if I have any words actually to describe about the trauma. I can tell, but I hope that your family is okay, Mohammed. Is your family and your loved ones are okay?
One of my cousin was bombed, and it was hard to when you just wait the injuries to come and you see your cousin dead. No, he was killed. And another big challenge when you are on a duty, you are fighting to rescue life. And my family calls me during. They are afraid. They tell me that the next house was shelled, and they are afraid that that general would come to our house and ask me to come back home to stay with them to support them. So you are in a complicated dilemma. Would you support your family, go and support your family, or just to stay at hospital and risk people's life? It's hard, really, it's hard. The situation in Gaza is beyond imagination, actually, beyond people's imagination.
So I hope, Mohammed, that you can stay for the question and answer sessions, just in case my colleagues have any questions for you. Next, I will introduce a gynecologist from Gaza Strip, Dr. Samia Abu Salah. She's a graduate from Cairo University in 2002, and she has been working for Palestinian Ministry of Health for the last 15 years as an obstetrician and gynecologist. And now she's also a candidate for Palestinian legislative elections in 2021. So Dr. Abu Salah, please, floor is all yours.
Good afternoon, or I want to say our colleagues, doctors, surgeons, all personnel working for a humanity auxilium, Dr. Fawzia Ilvi, all free people in Canada, America, and all over the world who have been watching our tragedy in the last days and who decided to support our wounded people who were already suffering a tight, suffocating siege for nearly 14 years, affecting many life sectors, including economic, social, educational, developmental, and of course, medical sector. As we went through 4 aggressions in the last 14 years, and every aggression we went through left more and more martyrs, griefs, injured people, homeless ones, destroyed buildings, including houses, schools, and universities. And when we were almost done of a crisis, we were put in another. And now we are facing a real massive challenge in our healthcare system that could be summarized in 3 points in my view. The first point is our hospitals' occupancies, as we have large numbers of martyrs whom were brought in pieces to hospital, as my colleague Mohammed has mentioned. A lot of injured people that needed surgical and medical treatment, and then after they will need follow-up treatment, physical and psychological rehabilitation. This happened within short time and need a relatively long time to recover. So we will wait for a long time to evacuate our hospitals. We have many patients in a limited number of hospitals. The second point is shortage of medications and medical supplies, as my colleague has mentioned. Medications mainly, and namely, we in bad need for anticoagulants, antibiotics, and analgesics mainly. Medical supplies and instruments and apparatuses, namely wheelchairs, crutches, surgical instruments, arthroscopic and laparoscopic apparatuses. The third point is that a medical staff shortage. As our region has been through a financial crisis, there were small numbers of employees. So we have shortage in medical staff, doctors, nurses, paramedics. And also because of the blockade, many doctors couldn't travel to continue with their specialty and training courses to improve their services. In our hospitals, we are in bad need for certain specialties and subspecialties related to vascular, neurological, and orthopedic surgeries. Also, we in need to employ more social and psychological services providers. Our needs for medical staff, as Mohammed has mentioned, we were working in hospitals and treating injured people, and we were trying to be strong, to be supportive to these vulnerable people, but indeed we were suffering and we were worried about our families. So we were in a real challenge to complete our duties, our job, our commitment to our people, and to be careful for our families. Finally, I want to say this meeting represents a landmark meeting, holds a special places in the hearts and minds of Palestinian healthcare provider, focusing on our healthcare services needs. And we are so thankful and grateful for your concern and your support, preparing such a great campaign for relief of our oppressed nation, bringing us together, helping to put an end for all these sufferings. Many thanks, respects, hoping meeting all of you in our land with love and peace. Thank you.
Thank you, Dr. Abu Salah. Thank you very much for your precious time. And I hope that you can stay here for the question and answer. Sure. I'm just going to quickly introduce now to Dr. She's Rawan Al-Harish. She's a Palestinian American. She's a doctor also. She's not a medical doctor, but Dr. Rawan Al-Harish is a Palestinian American Associate Professor of Health and Rehabilitation Sciences at Massachusetts General Hospital, Institute of Health Professions in Boston, Massachusetts. So Dr. AlQardi is in occupational therapy by training and is a scientist in cross-cultural validation of patient-reported outcomes, especially the assessment and intervention of community participation and disability among the refugee children and families. Dr. AlQardi, please come and tell us, because you are a Palestinian American doctor.
Yeah,
so
thank you very much. I was wondering if maybe Dr. Saeed Nafi' can go before me, because we agreed that he would introduce occupational therapy first. So he should be online with us. So if he can, I can pass the mic on to you, Dr. Saeed, and please introduce yourself and
thank you, Dr. Awan. Thank you very much. Thank you.
Yeah.
So I'm sorry, I am in a cafe and the connection is really bad. I just arrived to Morocco today from the USA, and so I apologize for the connection, for the bad connection. I literally just arrived a few hours to Morocco, and I did not want to miss this to support our brothers and sisters in Gaza and in Palestine. So as occupational therapy, we try to help people physically and mentally, and this is exactly what people in Palestine in general needs. So some of you may not know what occupational therapy is. So occupational therapy is a profession that helps people with different disabilities and different needs. And as a result of the aggression and the devastation that's happening in the last few days and last several years or many years in the area, occupational therapy is a needed services there. And so we, as the Arab Regional Group, that's part of World Federation of Occupational Therapists, which has had a great relation with the World Health Organization since 1952, I believe. So we're trying to offer some help, and we come across this group, and we would love to offer any assistance. So we're trying to connect and partner with some organizations who are having feet on the ground in Palestine, and we try to help as much as we can. Having said that, I have been listening to some of you, and as you have stated, the needs it's there, and so we're trying to, as I mentioned, know exactly how we can help, and because we are ready to help from the USA and from different regions of the globe with people in the Arab regions as well, including in neighboring countries near Palestine. I will pass the microphone to Dr. Ara AlQardi. So I did not introduce myself officially, but my name is Saeed Nafi. Again, I'm so sorry. I'm still jet lagged, and I am a professor of occupational therapy in the USA and the president of the Arab Regional Group to the World Federation of Occupational Therapists.
Thank you.
Thank you, Nafi. Yes, I was not sure if you are going to join us because you are traveling. Thank you very much. Yes, Dr. AlQardi.
Yeah, thank you. So I just want to, circle back to some of what my colleagues have started with in terms of the statistics and the numbers. So the situation in the Gaza region is devastating, and I'm not in the field to basically report on that. But from what I'm hearing in terms of the numbers of injuries, with close to 2,000 people being injured, and about 25% to 30% of these people have moderate to severe injuries, we have to basically supply anything that we are capable of, whether it's the services, whether it's the skills, whether it's the tools and the equipment needed to facilitate the recovery. And one of the things that is essential in the recovery of these injured people in the Gaza Strip, and to even add on the multiple, layers of the previous traumas and injuries that have occurred in the population in Gaza and in Palestine in general, is the attention to mental health services. And mental health is basically one of the most important tenets of occupational therapy. So I'm here to advocate for the services of occupational therapy and just to introduce our listeners and to people what occupational therapy as part of rehabilitation is. So occupational therapy introduces activities that are meaningful and purposeful to the individual. And in the past, we have seen a reduction of about 20% of the hospital stays to people who receive occupational therapy after injuries related from war. And this is basically what happened when our profession was developed after World War I. So we noticed that some specific specialties of nurses, they were working with war victims, and they started introducing meaningful and purposeful activities such as recreational art therapy, weaving, wood work, for example, and introducing activities that engage the individual so their mind is basically taken off from the injury that they currently have, and they feel that they have a purpose in life. And that overall reduced the amount of hospital stays because of the reintroduction of purpose that we bring onto our clients. And what we are hoping here to do is to introduce, this concept to people in the Gaza region. There are some occupational therapists in the ground in the Gaza region working, but not nearly enough to what is needed to cover the needs for people with injuries related from the injuries of the recent strikes. And in addition to that, the almost 370,000 children who have been suffering from some form of PTSD or post-traumatic stress disorder since 2014. That's the latest estimate that was published by the UNICEF. So I envision that this number, the 370,000 children, is a lot more now since the recent attacks that have happened over the past 2 weeks. So part of the things that we hope to introduce to the children who have PTSD and to people who have been injured from the war are, a unique set of occupational therapy interventions that focus on integrating concepts of motivation, bringing a sense of purpose, using activities that are important to each of these patients to add goals, wishes, skills, and think about the barriers that they have in front of them so they can go back to their life and integrate in their community participation so we can bring some type of psychological relief. We take care of things like wound care, manual intervention, therapeutic exercises to increase motion, to reintroduce walking after amputations and some orthopedic injuries. We work on increasing strength, activity tolerance as a foundation to enhancing function in various daily activities. We also work on engaging the patients with activity performance towards making sure that they're fully independent in their family. So we teach skills for activities of daily living, like how to get dressed by themselves after an injury, how to go to the toilet, how to bathe by themselves, how to eat by themselves after an injury, in addition to many, many more functions of daily life. And the ultimate goal is to basically be purposeful and to have purposeful and meaningful engagement in the community. So what we're hoping, to do with our collaboration with this NGO that we're working with is to bring in, the introduction of these services for people in the Gaza Strip and to introduce these services, hopefully moving forward. And that's it. Thank you for having the chance to speak about the importance of these services, and we're looking forward to working on the ground with the people who need the services the most. Thanks.
Thank you very much, Dr. Al-Harish, for telling us the importance of occupational therapy as well as the critical need for mental health support. And our team at Humanity Auxilium are looking forward to work with you and Dr. Nafe, how we can provide this support to the people of Gaza. So I will open the floor right now, and we have Dr. Abu Bakr Khalifa, who's a critical care physician in Burlington. Abu Bakr is an assistant clinical professor, and he will have some questions from you guys, and also Dr. Besreen. I will leave both of you guys if you have any questions with the healthcare professionals from Gaza.
Yeah, I mean, first and foremost, I think I want to thank everyone for making the time. I mean, not only is your time so valuable right now, it's critical. You know, you're deciding between spending time with your family versus working, and here you are letting us know of your needs for hopefully some change to be had. So, you know, you mentioned that the healthcare system has gotten worse and worse, and I just kind of wanted to know, what did the healthcare system look like, you know, a few months ago versus right now? And besides electricity outages and other things, like what are some of the factors that you think are playing a role? And I know some of you have mentioned it, but what are some of the maybe social determinants of health that are also impacting the way the healthcare system is being managed right now?
So I think anybody can, it's open question, so anybody can answer it.
So may I?
Yes, please.
Yeah, so as I said, at the moment we have 5 power engines which were destroyed out of 10. So, and that also adds to the fact that we at the moment have shortages of about 45% of the electricity. And also what adds to this problem is that the fuel that we don't have. Unfortunately, it is usually controlled by the Israeli authorities through Kerem Shalom border, which is at the moment unfortunately closed. So we're not having the fuel that we should be having in order to operate the generators which supply the hospitals and neighborhoods with electricity needed. For example, myself, I have been on and off. You might have witnessed that, me being on and off. That's mainly because of the electricity issue. And also, you can imagine the problem in the hospital, the machines that have been working, helping patients to stabilize themselves and helping them towards cure. And what happens in the hospitals is that they have the main supply that comes through the main generators we have in Gaza. That's source number one. The second source is the generators. And also, if you want to operate using those generators, we should have the fuel. And if we don't have the fuel, then there are no generators. So what we usually do in the hospital is that we rationalize. We give more electricity to departments that need it most, and then we reduce it where departments that doesn't or don't really need it. So the situation is really dire, and we should be working on different levels. The first one is providing fuel, and the second one, which is more importantly, to help resolve the issue of the damaged engines. And actually, the good news that I have been hearing is that they have started restoring those engines. So hopefully, in the coming few days, hopefully, I'm not really like optimistic like to the maximum, but hopefully they will, in a matter of 2 days, help restore some of those engines, and hospitals can resume operating on the usual terms. However, it's not a matter of this escalation, because the blockade has been like since forever. The fuel is not always like on daily basis available. So there are days that are better than any other days. That's what I can tell you.
I hope you have more better days, Mohammed.
Thank you. Thank you.
Yeah, I mean, I can only imagine how you are, you know, one of the things that kind of struck me was you said you're rationing electricity and equipment. And I'll let Dr. Abu Bakr Khalifa ask another question, but I think I'll have a follow-up to that one.
Inshallah. Assalamu alaikum, and thank you guys for even having the time to join us and educate us and give us more information about what's happening in the ground. And we're so grateful that you give us this time so that hopefully we can learn more, and we can help contribute in a way or another to the suffering of many people in Gaza. And one of Muhammad, you talked about particular stories and patients that you've experienced and throughout this past period, and as well as in the past aggressions. And one question I wanted to ask is if you can tell our audience a little bit more about the experience of patients that come into the hospital with the trauma coming into the hospital. How does that look like, and what type of care do they get? Where do they go from the emergency room department? And it's important for, I think, a lot of the healthcare providers to understand that overall experience. And a lot of times we look at numbers, but behind these numbers there are very important stories, and would want to give you the time to share with us some of that.
You are mute, Muhammad.
Do you hear me? Do you hear me?
Yes.
Yes. Okay. Maybe being a nursing supervisor, and I'm always in the front line, and I myself intervene with most of the cases in order to lead my team. I'll tell you and tell the audience how the situation looks here in the Gaza Strip. I'll give you an example, for example, to help all understand what is happening here. For example, a patient comes to hospital, to emergency department, has been bleeding for more than 2 minutes. So the first thing you are thinking of is to give IV fluids, like a normal saline or a ringer lactate, something like that. But you don't find even fluid, IV fluid, in order to save the hypovolemic patient. So you start running between departments in order to afford and get 2 or 3 buckets. This is happening in our hospitals. At least we lack IV fluids. Can you imagine how horrible the situation is in our hospitals here in Gaza? This is insane. This is crazy. This is mad. This makes you feels that there is injustice in the war. Another thing to help you understand and imagine the situation. Last shift, I was called urgently to a female medical department because the patient, a female patient, she's obese. She's maybe, sorry for saying that, she's about 120 kilos. She fell down her bed. She fell down from the bed. Do you know why? I'll tell you why. Our beds, and most of our beds in hospitals, have no side rails. Can you imagine? Can you imagine that? Can you imagine this crisis? Can you imagine how Palestinians are left alone to face poverty and face injustice? Our clinical beds, which we bought our patients on, most of them are 20 years old. Can you imagine? Another thing, a patient with COVID, you need to justify the bed, to justify the bed, or adjust the bed in semi-fowler or fowler position, because the patient is dyspnea, experiencing dyspnea. The first thing you are thinking about is to raise the bed in order to let the diaphragm goes down, and helps the patient to breathe. Our beds have no positions. You can't even raise the bed. You can't, I tell you what I do. For me, I just quickly collect some pillows, and put it in the back of the patient, in order to raise his back and helps him to breathe. Can you imagine? Is this humanitarian? How could people leave Palestinians like this? This is, I told you, we're just, regardless of being American or Canadian or Sweden or Belgium, we are human. We share the same nationality. This is the point.
Muhammad, yes, thank you very much, Muhammad. Can you tell us that what you need the most? It seems that you need everything. You need beds, you need hospitals, there's a power outage. So as your healthcare colleagues from US and Canada, what we can provide you the most?
Yeah, maybe we need urgently IV fluids, beds, because the beds are invalid and inappropriate for using in our hospitals. We need central monitors. For example, you can in ICU there are 20 beds in ICU. The central station is only with 6 monitors, so you can monitor only 6 patients, while the other 6 patients are not monitored because there is no an appropriate central monitor. Some people may die in ICU, and as a nurse, you don't know because they are not monitored. So we lack monitors. We lack central station of monitors in order to monitor and observe the 12 patients. For example, we need also to train our staff because we lack the fund to make courses or to make medical sources and programs for updating their knowledge and updating their skills. We need also surgical instruments. There are inadequate surgical instruments and anesthesia machines, for example. Yeah, like this.
Okay, thank you very much,
Ahmed,
Mohammed. So it seems that maybe we can work on telemedicine from here and maybe work on providing some critical ICU equipments, monitors, and ICU beds. So I think audience have some questions also. Nathan, I wonder that if you can pose some
I do
questions.
have a question, though, I think specifically for our OBGYN colleague.
Yes, please.
So, I mean, we often think about the lives lost from injuries, and I do recognize that there's a whole other struggle with birth. How have pregnant women been impacted? I think here in Canada, I can say, we take our prenatal care, well-equipped birthing units, and, for granted because they're so easily available to us. Patients know, when I'm in labor, pre-labor, I know who to call, I know where to go. I can only imagine what how this is impacting rates, death rates for children and mothers. And, how can we help improve access? And what are you seeing? What's going on with OB care specifically?
Thank you for this important question. Well, most of the time of the rates and with the bombardments over the civilian inhabitants, there were a lot of pregnant women who were scared, who were anxious to be reassured about her pregnancy. So they rushed to hospitals for reassurance, firstly. Some of them went into abortion miscarriages. Some of them went into preterm labor and need the admission to be observed and to take IV fluids and tocolytics and observation. So they need to be admitted to hospitals, leaving their families in that bad situation and with worrying about their kids at home. Some pregnant women came with the wounds, with the measles parts, and we have to deal with the obstetric case and consult surgeons to repair the injury. So the situation was so challenging, so stressful, but we managed, alhamdulillah, most of the cases.
Jazakumullah khair for the answers. Before we go to the audience, I really want to thank you, Mohammed, for the courage to share all these stories, right? Because, it's important for a lot of us who are working in very different clinical setting to understand these challenges. And it's important to a lot of times we see numbers, and it's important to share with us these clinical and human stories to see how we can provide further support. And I really appreciate you mentioning all these items that are basic items like IV fluids, like a bed rail. I just want to say Jazakallah khair for sharing those details. I will give the opportunity for people to ask more questions, but I'll ask another question or so if we have the time, inshallah.
Nathan, I wonder if you have some questions from audience, so you can leave from here.
Yeah, so we have this question that just asks, beyond emergency care, is there a way to leverage virtual care and technology to support? So I know we talked about some of the issues with electricity and that sort of thing, but just what are some of the ways that we can kind of work together virtually right now?
That's a great question. We are working on trying to come up with like online triaging system specifically for mental health services and rehabilitation services, where the people who need the severe interventions or the ones that need the most critical ones can be seen in person, but then the ones with the moderate and to the lesser extent that could be triaged to go online. But that comes with a different set of challenges, as many of you have discussed previously, which is the shortage of electricity and the reliability of internet. So what we're trying to do is to train people, such as community workers, on specific or very simple rehabilitation techniques in the ground, and then they will be able to deliver that to distribute. But again, that needs resources and that needs time, and that's why we need as much support as we can at this point. So we do have like a lot of rehabilitation professionals who are interested in volunteering with their time and their expertise, but we need better connections in the ground so we can do it. Thank you.
Thank you, Dr. Al-Harish. So I just want to mention one point here that at our team at Humanity Auxilium, we are working with Turkish Red Crescent on the ground, who are working with Palestinian Red Crescent, and they are doing the need assessment also, and they are helping us to provide the equipment. We are in the process of buying a fully equipped large ambulance that will help the people of Gaza, as well as we are working towards providing manpower also. Manpower, it's a little bit complicated, the access of doctors to go to Gaza in terms of any specialist, but in the last few days, I have lots of our colleagues from US and Canada, lots of specialists who are willing to go to Gaza. So as soon as we are allowed to go to Gaza, and we are going to come and help you on the ground.
I think I have a bit of a logistical question, and I know you've addressed a lot of them. Maybe for Dr. Ara AlQardi. With many people having lost their homes, I can imagine discharging patients and managing hospital numbers, admissions, and all the space constraints are not easy. How are you navigating that? Are there, local sites? Are there camps that you're setting up? What does it look like in just logistics, numbers? And also, I know, Mohammed, as a nursing lead, you're also managing numbers. So what does that look like?
Yes, so at the moment, the first escape that families usually think of when an escalation happens or something bad happens to their houses, they tend to evacuate their houses and take shelters at UN schools. Usually, at those times, UN opens its school to accept those people. Sometimes they provide them with essential food and non-food items, and other times they take quiet time to respond to this because of the massive influx of people. So hopefully, and on the bright side, there are usually something that is called emergency preparedness plans in each and every humanitarian and NGO organizations. So that's when they set their priorities and think what would happen if something really happened. So they have plans for those people. However, those plans are not usually adequate enough to respond to the massive influx of such. That is something. On the other hand, people tend to escape and take shelter at hospitals, the MOH hospitals. I'm not sure if you have seen footage from the ground, but many families are constructing actually their own camps in the hospital, which adds to the fact that hospitals are really overcrowded. Of course, they're not taking shelters in the inpatient ward. However, they are taking shelters in the outdoor spaces and the gardens in the hospital. So the situation would be really horrible in case this or such things happens here in Gaza. Here we have also the protection cluster. Also, we have the healthy cluster. That's an association between the if I am to say the key players here in health and child protection and other agencies. They have plans for those people. Sometimes they conduct sort of joyful and funny activities in those areas, like you do in schools and hospitals, just to support people, as we said, mentally and psychosocially. However, it is really devastating. And so far, according to the last report of WHO that was circulated yesterday, still we are having 66,000 people out of their houses because they are destroyed. At the moment, actually, there are agencies and humanitarian workers who are going into the ground, taking data from people, trying to replenish them or reimburse them with a bit of money so that they seek areas for rent. However, it will take time. It will take time. Actually, for myself, for some reason, during this escalation, I myself evacuated my house. And literally, I had no place to go because all of my relatives were evacuating their houses and coming into my house. So altogether, the Ara AlQardi families, we were displaced. We really knew no place to go. So what happened is that we chose the least dangerous area, that is the first floor of our building, and we said, okay, we'll coordinate, we'll just live with it, and we'll accept whatever happens to us. It is dangerous. However, it is nothing that is left for us. It is just this place that we should be taking shelter at. So we stayed there. Alhamdulillah, nothing happened. We are safe. But anything would have happened. Anything would have happened because no place is marked safe here in Gaza. I'm sorry. I might have not really answered your question, but hopefully in the very soon I will get back to you with the stats from the reports about those and about the organizations that are helping people taking shelters and rents for their families and their kids.
Thank you. I think that gives us a bit of a picture. And, here in our very resource rich areas, we're always thinking disposition, right? Dr. Khalifa, you can comment on this. What next? How do we move one patient from here and on to going back home? So for sure, that sounds like a huge barrier among others that you're facing.
Thank you very much. The whole world is fighting a COVID-19 pandemic, right? And that on its own has its challenges to a healthcare system in various settings in the world, let alone amidst all the crisis.
I think he went on offline. He's calling us from the hospital. He's on call today.
I can, I guess, try to talk more on that, but I think what we wanted. Oh, he's back.
It looks like he might be having some connection issues. Do we have him back? Perfect.
Sorry about that. Can you guys hear me okay?
Yes.
I hear you,
yeah. Sorry, I'll just make my question brief on that. Is, how are you guys managing the COVID-19 pandemic? On top of that, all these issues that are happening in the hospital systems in the last few weeks. Can you tell us a little bit more about that, to give everyone perspective on these different factors that make this healthcare system management very challenging?
Okay,
and this
may
whole
I?
question is open for anyone who is.
Okay, so I'll just, in a nutshell, tell you about the situation before the escalation and after. So before the escalation, we tend to have like a decrease in the wave, in the second wave here in Gaza, and that was due to the restrictions that have been put in place by the authorities here. Um, um, at that time, we were having like batches of vaccines from the COVAX campaign that is run by the WHO. However, it was really like slow and not adequate for all people registered for the vaccine. At that time, we had about less than 0.2% of the strip vaccinated. So that's the issue before the escalation. After the escalation, unfortunately, one of the shells that fall down on one of the buildings that was just beside the center where COVID-19 testing and vaccination takes place at the ministry. So it wasn't directly targeted, but some near place was targeted and it affected the laboratory there. So it stopped for about 3 days. For 3 days, we had no idea about numbers of COVID-19, about the positivity rate and other things. The issue that I mentioned, that people are now overcrowded in specific areas, and the MOH has been talking about rising concerns about this, starting a third wave of COVID-19. Actually, unfortunately, it is happening. Today, they reported that the lab resumed operating, alhamdulillah. However, the positivity rate is increasing, and today it was about 35% positivity rate of the test. So that's from my point of view. It's not evident yet but I believe that we are going through starting the third wave of COVID. And about the vaccination, unfortunately, still the situation is as it is. At the beginning, it was deteriorated because the authorities, not local authorities, I mean the Israeli authorities, didn't really take the responsibility to deliver vaccines to Gaza. And then when the COVAX campaign happened, led by the WHO, it facilitated the response. And as I said, batches of vaccines entered the strip. Nowadays, the talk unfortunately has changed because there is the element of hesitancy. People are not really trusting the vaccines because you might have faced this in your societies as well. And people of Gaza are quite active on social media, so they hear from here and there about the side effects of the vaccines. So that's another item that adds to the decrease in the vaccination rate among the population. So generally, I can say that COVID-19 is a huge risk, and unfortunately, we are going into a third wave, God forbids.
Yeah, no, that's very challenging, and I think one of the things that we can take out from this discussion is many people around, whether it's Canada or North America, have been working in organization and in implementations for different interventions during COVID-19, as that is an important factor that we need to account for and think about ways how we can support the COVID-19 pandemic amidst all of the other shortages and all of the other challenges that are being faced. So I think we ought to be deliberate about that to make sure we can support. I mean, I can say from our clinical settings here, our ICUs are overcrowded with their with the different waves. Our resources are becoming even more limited. But I can only imagine in the situation in Gaza how much of a problem that becomes. And I think we ought to be deliberate about how we can support in different ways these programs, interventions, and resources for your healthcare provider teams as well as patients. thank you for that.
So, Dr. AlQardi, I just have a quick question. Do you have any stats, how many percentage of population they have been vaccinated right now? Because you were telling us about the hesitancy towards the vaccine now.
Yes, I have. I'm not sure. Can I share something like some details about this right after the conversation? And I'm not sure how you can circulate that among the attendees, maybe, or participants or hosts at least. Because we have those regularly produced reports by the MOH, and I'm happy to share with you because they are public and they are all available there, and you can know about all the details about COVID-19 in Gaza.
That would be great, and we can share it from our website, and we can share it with our colleagues and attendees.
Do we have some more audience questions? Otherwise, we can have a few more. Or actually, I also want to open the floor to our colleagues in Gaza for questions for us. I don't know if there are tough cases that is that some way that we could support? Could we support you virtually somehow? I'm not sure that the needs do seem quite high, but we do want to make sure that we also support you, whether it's nurses, first responders, paramedics, doctors, or even it almost seems like there's, the general public who are now becoming first responders. The toll on everybody is immense. And so, how else can we support you and your mental well-being and all of that and all of the struggle?
And I guess this question is for everyone, anybody who can answer, because we cannot imagine the amount of trauma you guys all going through. I think you are mute, Mohammed.
Yes. I don't know what's wrong with this. Can you hear me? Can you hear me? Yes. Regarding, first of all, regarding COVID-19, we have talked about just general topics and as in the world, but just to be specific, to talk about hospitals, I think the most important thing to have while dealing with the COVID patient is flow meters. You don't have enough flow meters to give oxygen to patients. So many times happened with us in Nasser Medical Complex. A chair patient, low saturated, desaturated. So you want to give oxygen. So there are no flow meters. So you you start evaluating the patient, which patient is improving. So you took the flow meter and exchange it and connect it to the other patient. So we exchange flow meters. Imagine how could you face COVID-19 and you don't have adequate flow meters for COVID patients. And other thing, elevators in our hospitals. Maybe Nasser, Dr. Samia may know what I mean. The elevator in Nasser gets faulty every 1 week. One time every week. So sometimes you have just to hold the patient on your hand, and other one help you, and you go upstairs to the second floor or the third floor. And this has happened with me many times. Also, oxygen station. The oxygen station is not enough here in Nasser Medical Complex, and sometimes you have to be careful, and you have to calculate every liter you give to patients, because they inform you that the oxygen is not enough. So we have to be careful. Sometimes the doctor's orders is 9 liters, for example. We give 5 or 6 because the station can't meet patients' needs. You imagine. Also, maybe I'll talk about psychological rehabilitation, as Dr. Rawan has mentioned. First of all, I think the medical staff, nurses staff also need a quick and a serious program for psychological rehabilitation, because we have been suffering a lot and during 4 wars in a short time. I want to be brave enough. I have sought psychological support. I visited the psychiatrist and I received medication. I'm not shy of this because no one can tolerate what we are facing here in Gaza. No one can tolerate. Also, I'm going to talk about motivating medical staff. By the way, maybe a lot of people don't know that medical staff and all employees here in Gaza have been receiving 40% only of their salaries. They don't get enough salaries. So suppose that a nurse or a doctor gets only 40% of his salary. We talk about $300 only. During such critical situations, maybe he needs to have a psychological consultation. So the money is not enough. Can't save him to visit a psychiatrist in order to ask or to seek for psychological medication or support. So I have a suggestion here. Why not motivating medical staff and trying by different organizations to improve their salaries at least? This may help meet their own needs. Another thing I want to talk about is something strange happened for many of our colleagues. They had an opinion, and people here in general also. They have an opinion to exchange kits, and I think you can ask about this in Gaza. It was common during the last aggression. You have 4 kids, and I have 4 kids. I give you 2 of my kids, and you give me 2 of your kids. Then, if your house was destroyed over your head, I can lose only 2 kids, but the remaining the remaining other kids are safe with me. And if my house was shelled, then the other 2 kids of me are safe in your house. Can you imagine this happening in Gaza?
So, you know,
Uh,
I was hoping to actually ask a follow-up, and I don't know. I can only imagine what you just described is definitely something that I cannot imagine, choosing between your children almost, right?
yeah,
So,
sure, sure.
so, in the medical field, and I can't say I've come across this, but it's something we all as physicians sometimes at least have to think about, especially those, who work with Doctors Without Borders. Sorry, can you hear me?
Yeah, yeah.
Okay. So, sometimes you have to make tough decisions, and many of them impact people's lives in an unimaginable scale. And I'm actually scared to ask this question, but have you or maybe all of you have found yourself in a situation where you've had to choose between you could and could not help, and what guides those decisions? I think Dr. Ara AlQardi is about to say something. Go ahead.
May I? Yeah, so that's something that I really wanted to raise here. When we talk about Gaza and when we talk about Palestine, we always mention the traumatic events and the emergency needs. However, there are plenty of subspecialties in medicine that should needs assessment and also should need intervention. And one of the situation that I haven't myself experienced, but when I was doing needs assessment, I heard it from the physicians, is that it's a very simple thing, the growth hormone. I'm not going to be talking in medical terms because I understand that audience are not really, like, all of them are medical. So I'm talking about the growth hormone. It was at a zero stock level at the Ministry of Health. And when we asked physicians, how do you deal with this case when you have not enough vials for everyone? And their answer was, we rationalize. We think that this child is a female, so because of the way that the community would look at her, it would be best to choose this female over this male. It happened. Other times it happens regarding the age. Sometimes they think, or physicians think, that this is still baby and he or she needs the growth hormone, so that they reach to the stage that it's okay, that's fine, and it's enough for them. That's something. The other case is that talking about the oncology hematology departments, and especially the chemotherapy sessions, I'm not sure how to express that in a simple way, but there are medications that are given in between chemotherapy sessions, before and after, in order to reduce the vomiting and the gastric disturbances that happens in between. Unfortunately, the most important drugs that are used for those items are at zero stock at MOH, and it is official, it is always at zero stock level. And whenever fund is found for those items, usually it is shifted it is directed towards emergency and traumatic activities, because it's always like on fire here in Gaza. So patients are asked to procure those from local market. People of Gaza are not really financially stable to be able to procure this from local markets. So what they take is, they take very simple and ineffective drugs. They take like, I don't want to be really medical, but they take really simple medication that, if I myself have a gastric upset, wouldn't really cure me. So imagine the situation for a patient who has been struggling physically, psychosocially, mentally, from a tumor, a malignant tumor, and having a chemotherapy that has consequences and side effects. So this is the things that I really wanted to raise, to always think that there are other specialties that in need of supply. If the emergent and the traumatic areas that are usually attracted by donors and fundraisers, there are many other areas that are not attracted by donors or fundraisers, and they are at zero stock always. So that's a message that I really wanted to highlight.
Those are very key examples that you gave to kind of make us think of other situations where this rationing works too. So I can only imagine how these decisions are being made. I know near the beginning of the pandemic, there were talks on, if our hospitals get overloaded, like we saw, initially in Italy, where they were also making these decisions of who to admit, who not to admit, using age, using all these other criteria, what would we do? And we're talking about Canada where we have an abundance of supplies and hospitals, and we're prepared. And so for you guys to all of a sudden be hit with this is quite difficult. I think for the sake of time, I just want to give a bit of a summary. I think as healthcare professionals, we know how important the social determinants of health are to well-being. And for those who are not familiar with that, that's things like income, education, job security, food security, housing, early childhood development, and essentially everything that shapes a community to be healthy. And I think it's very clear from speaking to all of you that almost all of these factors are being impacted, and it will have a ripple effect on the coming months to years unless we work to change it. And so your voices are, so important. Your presence right now is important. And I think for our audience, we need to make sure that everybody here is going to, take this seriously and donate and have a more of an impact, not just through our words, but through our actions to helping our fellow colleagues there.
Thank you, Dr. Basreen. I just have a last minute questions. Few of my colleagues have sent it. So as we can hear from all of you that you guys are in a situation that, Dr. Muhammad, Dr. AlQardi told us that he had needed to be evacuated with his extended family, and you have to take shelters, as well as Muhammad also mentioned how he's dealing with his mental health. So we want to know that if there are any mental health support for you guys, for healthcare professionals on the ground, if there are any groups like physicians in US and Canada, we have mental health support through our college, through our professional associations. If there is any where you can go and debrief and talk to someone.
As far as I know, no. My answer is no. I myself haven't been asked if I experience something to go to through this channel to reach that one. However, what I know is that the major hospitals here in Gaza, like for example Shifa Hospital and European Gaza Hospital, I'm not sure about Nasser. However, maybe Muhammad can update us on this situation. I know that they have like, if I'm to say, like mental health support subspecialty, and they usually, when practitioners and physicians do ward rounds, they are usually accompanied by one or two of those, especially when we're talking about children and other marginalized group of people, like people with disability also. I see some of them supporting patients, but I myself as a physician, I have never heard of a support for myself or my colleagues.
So in the past few days, as a physicians and our team, we were talking about providing mental health support for people of Gaza. And but I never thought actually until to this point while talking to you that is there any support available for healthcare professionals? So maybe here, my colleagues here, as well as who are listening, we can work towards establishing a mental health support line for you guys, maybe a 24-hour support line only for healthcare professionals, because you guys are so precious for us. As we are hearing that there's a acute shortage of all the specialties and the doctors, and there's in the last few days we have heard about the death of 2 specialists here, and such a huge loss for the community of medical community in Gaza. So hopefully we will be in touch with you after this webinar and see how we can provide a mental health support for healthcare professionals on the top of the people of Gaza. I think due to the time, unless we have any other questions, I think we should wrap up, because your time is precious and you guys have all finished long shifts in the hospitals. I know that 3 of you from Gaza.
Thank you, Dr. Fawziya Elfai. Thank you, Nathan. Thank you, all of the colleagues, for this precious meeting.
Mohammed, I think you're muted.
Thank you all. It's very nice to talk to you all. I'm very pleased to get the chance to speak here and to speak with you and speak to the public. Thank you.
No, thank you, everyone. And I think this is an initial conversation to learn more and to educate each other. But I really think that the hard work comes next, as we start thinking on how to mobilize different interventions and different programs to help support and learn from each other. And God be with all you guys. And Assalamu alaikum. Thank you so much for having us.
Thank you very much again for educating us, for telling us what the needs are on the ground and how we can help you from here. And again, thank you very much from all of our team and from MMSC team also.
Thank you.
And for our viewers, please donate. That's going to be key in implementing a lot of these.
Yes,
so
and
yes, go ahead.
Yeah, sorry. Yeah, no, I'm saying that on behalf of myself and people of Gaza, I would really like to thank you very much for thinking and considering our suffering. And I know that even your support and the prayers would really mean a lot to us. However, please just think about other areas other than the traumatic specialties, and hopefully together we will make something helpful for the community of Gaza. Thank you so much.
Thank you. So people who are listening, they can go to our website, humanityauxilium.com. It's a registered charity in US and Canada both, and people can take tax-deductible receipts for it. And please stay tuned for the future updates and how we are doing and how we are developing mental health program and how we are doing with Dr. Harish out of Boston, how we can all working together. Thank you very much.
Thank you.
Thank you. Nice meeting everyone. Thank you.
Bye.
Bye.
Thank you.